Hello, my name is Elon Johnson, and I have a presentation for you, and this is regarding mammograms and the importance of mammograms and why we must start mammograms at age 40. Please review the presentation, and if you have any questions, please do contact me, and I will respond, even if that response requires me doing additional research. I do thank you for your time, and I hope this is valuable information. And if not for you, maybe you can forward it on to someone or have someone look at this information for themselves. Thank you for your time. This slide is speaking on not allowing someone else's fear to persuade you in not having a mammogram. It is important that you not listen to others when it comes to your well-being. Most people only have their well-being at heart, not yours. Mammograms can save lives and they are uncomfortable, but that discomfort doesn't last long, and don't let someone persuade you out of possibly saving your life. Only you can save your life. There are risks to having mammograms. I mean, we are being introduced to a small amount of radiation, and mammograms are not 100%. But there isn't anything that is 100%, but this is, in fact, the best that we have to offer at this time. So please do continue to have your mammograms and outweigh the good versus the bad. The worst thing that could happen is you'll be a little uncomfortable, maybe a little sore, but the risk outweigh the benefits. So please do continue to have or start having, if you have not had a mammogram, start having them. It could save your life and keep your family happy for a lot longer. There are some ethnicities that do tend to die at a higher rate from breast cancer than other ethnicities. African American women and Hispanic women tend to die at a higher rate. Hispanic women tend to have breast cancer a lot less often than other women, but die at a higher rate because they don't seek attention early on. They may feel a lump, they may see a change, they may see orange peeling look, they may see an inverted nipple come about, but they don't seek attention, and so therefore they're dying at a higher rate versus Caucasian women. Caucasian women tend to have the highest rate of breast cancer, but when you look at the numbers of how many Caucasian women have breast cancer and survive it, it's substantial. And the reason for that is white women, Caucasian women, tend to seek medical attention regularly. They tend to have their mammograms annually, their pap smears annually, and by doing so, they are able to catch cancer sooner and have a better prognosis. So we must all do as Caucasian women. Also, there are women that are of Eastern European ethnicity or from the Eastern European region that also tend to have breast cancer at a higher rate. And that's more genetics than anything else. And then younger women that tend to get breast cancer tend to get very aggressive breast cancers, but they tend to be very treatable if they in fact catch them soon and see a doctor and seek the necessary attention to care for their breast cancer. Speaks a bit on the different types of breast cancer. In situ is a less aggressive breast cancer, and you're more likely to survive it and be able to bounce right back to your normal life in a short period of time. Then there is an invasive breast cancer, which For some, the prognosis is very poor, and for others, the prognosis is a little better with chemo and radiation. But again, your life is worth being treated for breast cancer if in fact you were to come down with breast cancer. So don't let the fear of the unknown stop you from caring for you. There are a couple of different types of mammograms. They all require compression, so don't get me wrong when it comes to that. But there are two types. There is a two-dimensional mammogram, and then there is a three-dimensional mammogram. If you can, or if your facility offers a 3D mammogram, I would suggest that over the 2D, being that the 3D does provide the radiologist, which is the doctor, with additional information that is not available on a 2D mammogram. However, I would not have a mammogram just because a facility does not offer a 3D mammogram. A mammogram is better than not having a mammogram. And again, compression is required. You may see things on the internet, you may read things, you may hear articles on news broadcasts stating that there are new types of mammograms. No such thing. A mammogram does require compression, and it is important that you care for you. No one else will. This is a picture of a very dense breast, and this breast here would benefit from being seen or visualized under 3D. But once again, do not have a mammogram if your facility only offers 2D. 2D is better than not having a mammogram. Now the images here are in 3D. This is still a mammogram, but it is in 3D, and you can see this mass or lesion at different levels in this breast. And this is the advantage over a 3D mammogram versus a 2D mammogram. However, once again, a mammogram is better to have in 2D than not at all. Thank you. Ladies, please don't let the cost of a mammogram be the reason you don't have a mammogram. There are many free programs out there that will provide you with not only a free mammogram, but a pap smear as well. Every Woman Counts is one of those such programs that will provide a woman that does not have insurance, is underinsured, a mammogram and a pap smear. And you should be able to find that information out through your local government if you are not aware of it at this time. Also, you may be able to contact your local hospital to see if they can refer you to a facility that provides free mammograms for the underserved or just uninsured, whatever your history may be. But don't let cost be a problem. And for those of us that do have insurance, your insurance will cover a mammogram starting at age 40 and will continue until I don't know of most insurance stopping mammograms. I have patients that have mammograms at 85, and these women look healthy, are healthy, and may live to be 105, maybe just 100, but this mammogram could potentially add years onto their lifespan, so they continue to have mammograms. So once again, don't let the cost be the reason you don't have a mammogram. Contact your local government and find out free programs in your area. Thank you for your time. You may be able to tell I haven't done many presentations, so I may come across speaking a little too fast, not so clearly. thanks to the braces, but I hope I gave you some information, and I hope the information that I provided will persuade you to continue to have mammograms or to persuade one of your loved ones to have a mammogram. Again, no one can save your life but you. No one is going to care for your health but you. So you must put you first. And we as women always tend to put everyone else before ourselves. We must stop that, because if we don't care for self, we can't care for anyone else. So remember, have your annual mammogram, and please have the best life possible. Thank you.